When it comes to stroke recovery, sometimes surgery is needed. So to discuss our surgical options, we are joined today by Dr. Sanjeeva Antadu, a neurologist at UAMS. This is UAMS Health Talk, the podcast by the University of Arkansas for Medical Sciences. I'm Caitlin White. So, Doctor, today we're talking all about surgeries and strokes. So, after someone has a stroke, in most cases, is surgery needed?
So, first thing to understand is there are two different kinds of stroke. One is called ischemic strokes, which are more common. Ischemic strokes are caused by blockage of blood vessels in the brain. And the second kind of strokes are called hemorrhagic, where the blood vessels burst and there is blood inside the brain. So typically there are a subgroup of these hemorrhagic strokes called subarachnoid hemorrhages, where there are some aneurysms in the brain which burst out and then cause bleeding in the brain. So usually those kind of ones need immediate surgical intervention. That means neurosurgeon or interventional radiology people needs to go in and do surgeries. Those are the most common kind of surgeries we see for strokes, especially hemorrhagic strokes.
So let's dive into those procedures a bit more. What are our options when it comes to surgery for stroke patients of either type of stroke?
So most common causes among strokes are ischemic strokes. That's from blockage of the blood vessels. So anytime there is a blockage of blood vessels, so if patients identify the symptoms of stroke, usually easily remembered by the mnemonic BFAST. B stands for balance, E stands for eye problems, F stands for facial droop, A stands for arm weakness, S stands for speech problems. And if you notice any one of these, the last T stands for time to call 911. So if they notice any one of these and they come to the hospitals within 4.5 hours, and sometimes even beyond, we can give a medication called Alteplase. Alteplase is a very strong blood thinner, which dissolves the clots and is very helpful for patients with ischemic strokes. There are some other kind of ischemic strokes where there is a big clot in the blood vessels inside the brain. For those kind of patients, we do a procedure called thrombectomies. This procedure is where the interventional radiology or neurologists go inside the arteries, go all the way to the brain, and suck the clot out so that blood is restored to the part of the brain. So these are the most common acute treatments available for ischemic strokes. When it comes to hemorrhagic strokes, if there is what we call intracerebral hemorrhage, if there is a bleed inside the brain, so usually for those kind of patients, depending upon where the bleed is, if it's closer to the surface, then we can do surgical evacuation. That means surgeons can open the skull and take the bleed out, but it's not common. And if there are fluid pockets in the brain, if there is bleeding inside that, they can put what we call EVD, which can drain the blood out. Along with this, the most other common thing which we talked about initially is for patients who have aneurysms and they bleed. So they have two different kinds of treatments. Surgeons can go in and put a clip to that aneurysmal part, or the interventional people can go in and put in a coil there to prevent any more leakage of blood from that area. So these are the most common procedures or treatments available for stroke patients.
Let's talk about the timing of surgery. When it looks like it's going to need surgical intervention, is it usually, part of a process where you've tried other options, or are there strokes where it's kind of we need to do it right now? When does surgery usually come into the picture?
So ischemic strokes are very time dependent. If there is, for any reason, there is blockage of blood vessel, so each minute of untreated ischemic strokes, you can lose about 1.9 million neurons. So it's a very time dependent process. So the sooner we do any kind of treatments, the better. So currently we can give TPA for most patients safely up to 4.5 hours from symptom onset. That means 4.5 hours since last on time. That means if someone starts to have stroke 10 in the morning, we have until 2:30 in the afternoon to give Alteplase treatment. This is the strong blood thinner. Beyond that, the benefits will not be as useful for stroke patients. But if they have a clot and they're having a large stroke, we can go after that clot and suck the clot out in a procedure called thrombectomy up to 24 hours. We have to select these patients very carefully. We have to do some additional scans to see if the brain is still viable or no.
So once surgery has been decided upon and done, what does recovery look like?
So it depends upon how much of brain is healed, both for hemorrhagic strokes and ischemic strokes. After the procedure, we repeat scan to see what is the amount of damage. If the procedure is completely successful, they open up the clot and the brain did not suffer any brain damage. We had patients who had this procedure done yesterday and then who is being discharged today from the hospital. So they are completely back to themselves and they're going home. At the same time, we had some patients who got the procedure done, which was not completely successful. They needed some more time in the hospital and some more rehab when they go out of hospital. So it depends upon how soon we can do. The sooner we do any kind of procedure, the better for the patients.
Well, doctor, is there anything else that you want patients and their loved ones to know about stroke surgeries?
So the main thing about strokes are identifying the stroke symptoms is key for anyone to notice. Again, it's easily remembered as BFAST. As again, a B stands for balance, E for eye abnormalities, F stands for facial droop, A stands for arm weakness, S for speech or slurred speech. When you notice one of these, it's time to call 911. So the sooner you come to the hospital, the more you have good chance for getting these acute treatments and getting the procedure you need to save brain cells.
Well, thank you so much for your time today, doctor, and this valuable information. Of course, when it comes to strokes, timing is everything. To make an appointment today, give us a call at 501-686-6124. That's 501-686-6124. And thank you for listening today. This has been UAMS Health Talk, the podcast by the University of Arkansas for Medical Sciences. I'm Caitlin White. Stay well.